I need to ask you something, and I need you to take this seriously. Last night, while you were sleeping, was everything actually okay? Because here's what most people over 60 don't know. In every 24 hours, more than 2,000 Americans over the age of 60 die in their sleep. The hours between midnight and 6 a.m. are statistically the most dangerous hours of your entire day. Not when you're driving, not when you're working, not when you're stressed, when you're sleeping. And the terrifying part? The people who are most at risk feel completely fine before they go to bed. They brush their teeth. They say goodnight. They close their eyes. And for some of them, they don't wake up. Now, I'm not saying this to frighten you. I'm saying this because there are 7 specific, measurable warning signs happening in your body right now that most people completely ignore. Signs that your body is sending you every single night. Signs that, if caught early, can be treated, can be corrected, can save your life. And today, I'm going to show you every single one of them. Stay with me until sign number 5, because that one is responsible for thousands of deaths every year in seniors over 60. And it has nothing to do with your heart. My name is Dr. Ryan Vance, and in all my years working with patients over 60, the conversation I dreaded most was never in my office. It was the phone call, the one that came from a family member, usually early in the morning, saying, "Doctor, he went to sleep last night and he just didn't wake up." And every single time, when we looked back at the history, the signs were there. Weeks, sometimes months before. Small things, easy things to dismiss. Oh, he snores a lot. She wakes up with headaches sometimes. He goes to the bathroom 4 or 5 times a night. These weren't random inconveniences. These were warnings. And today, I'm going to make sure you know exactly what to look for. Because the research is clear. According to the American Heart Association, cardiovascular events during sleep, including fatal arrhythmias and sudden cardiac arrest, are significantly more common in adults over 60 than any other age group. Significantly more common. And the reason is simple. Your body undergoes dramatic physiological changes during sleep. Blood pressure shifts. Heart rhythms change. Oxygen levels fluctuate. For a young, healthy heart, the body handles this without issue. For a heart that's been working for 60, 70, 80 years, those same normal sleep processes can become dangerous, sometimes fatal, if the warning signs are already present and ignored. So let's go through them. All 7, right now. Sign number 1. Loud snoring with gasping or choking. Sign number 1. Loud snoring. Specifically snoring that is interrupted by gasping, choking, or complete silence. Now I know what you're thinking. Doctor, everyone snores. That's not a warning sign. And you're right. Simple snoring alone is not the issue. What I'm describing is something very different. It's called obstructive sleep apnea, and in seniors over 60, it is one of the single most dangerous and most underdiagnosed conditions that exists. Here's what actually happens. While you sleep, the muscles in your throat relax. In people with sleep apnea, they relax so much that they completely block your airway. Your brain, sensing no oxygen, panics. It jolts your body just enough to restart breathing. This can happen 30, 40, even 80 times per hour, every single night. And here's the part that should concern you most. A landmark study published in the Journal of the American College of Cardiology found that untreated sleep apnea increases the risk of sudden cardiac death during sleep by over 400% in adults over 60. Over 400%. Because every time your oxygen drops, your heart is under stress. Your blood pressure spikes. Your heart rhythm is disrupted. Night after night after night. The warning signs to watch for. Your partner reports that you snore loudly, and then suddenly go completely quiet, and then gasp or choke. You wake up feeling like you never slept, no matter how many hours you were in bed. You wake with a dry mouth or a sore throat. You fall asleep unintentionally during the day, in a chair, watching television, even mid-conversation. If any of these are happening, this is not a minor inconvenience. This is a medical emergency hiding inside a normal night's sleep. Ask your doctor for a sleep study immediately. A CPAP machine, which keeps your airway open during sleep, has been shown in research to reduce the risk of nocturnal cardiac events dramatically. This one sign alone, if caught and treated, could add years to your life. Sign number 2, waking with morning headaches. Sign number 2, waking up with a headache, consistently, in the morning, not occasionally, consistently. Most people shrug this off. I must have slept on my neck wrong. I'm dehydrated. I was stressed yesterday. But if you are waking with headaches more than 2 or 3 times a week, your body is telling you something that you need to hear. Morning headaches in seniors over 60 are one of the most reliable clinical indicators of two very serious conditions. The first is sleep apnea, which we just discussed. When your oxygen drops repeatedly during the night, carbon dioxide builds up in your blood. That buildup causes your blood vessels to dilate, and you wake up with a dull, throbbing headache that usually fades within an hour or two of being upright. The second is nocturnal hypertension, a condition where your blood pressure spikes dangerously during sleep. And this one is particularly dangerous because you may have perfectly normal blood pressure when your doctor checks it during the day. Here's what the research shows. Normally, blood pressure drops by 10 to 20% during sleep. This is called the dipping pattern, and it's protective. It gives your heart a rest. But in a significant percentage of seniors over 60, particularly those with diabetes, kidney disease, or a history of cardiovascular issues, this dipping doesn't happen. Blood pressure stays high all night, or in some cases, rises. A study published in the journal Hypertension found that non-dipping blood pressure that fails to drop during sleep, is associated with a significantly higher risk of stroke, heart attack, and sudden cardiac death compared to daytime hypertension alone. And your regular daytime blood pressure reading will never catch it. If you wake with frequent morning headaches, ask your doctor about a 24-hour ambulatory blood pressure monitor. It measures your pressure continuously, including while you sleep. This single test could reveal a danger that a standard office visit would completely miss. Sign number 3, night sweats, unrelated to temperature. Sign number 3, waking in the night drenched in sweat when the room is not hot. Now, women over 60 often associate night sweats with hormonal changes, and that is sometimes the cause. But in both men and women over 60, unexplained night sweats that are severe, frequent, and unrelated to room temperature are a warning sign that should never be dismissed. Here is what they can indicate. Number 1. Nocturnal hypoglycemia, dangerously low blood sugar during sleep. This is particularly common in seniors who are diabetic or pre-diabetic. During sleep, blood sugar can drop rapidly, especially if medications aren't properly balanced. The body responds with an adrenaline surge, racing heart, sweating, sometimes nightmares, or confusion. In severe cases, this adrenaline surge can trigger a fatal cardiac arrhythmia. A study in diabetes care found that nocturnal hypoglycemic events in seniors over 65 were associated with a significantly elevated risk of cardiovascular events, including sudden cardiac death. And the frightening part, many of these episodes happen while the person is completely asleep. They don't wake up. They don't know it happened. Number 2, undiagnosed heart failure. One of the early signs of a weakening heart is the body retaining fluid during the day and redistributing it at night when you lie flat. The lungs work harder, the heart works harder, and the body sweats. If you or someone you love is waking up drenched in sweat regularly, check blood sugar levels. Have heart function evaluated. Do not assume this is normal. Sign number 4, frequent nighttime urination. Sign number 4, getting up to urinate 3, 4, 5 times a night. And I need you to listen carefully here, because this is the sign that most seniors accept completely as normal aging. Oh, that's just what happens when you get older. No, it is not. Waking once during the night, possibly normal. Waking 3 or more times, that is your body flagging a problem. And the connection most people don't know. Frequent nighttime urination, called nocturia, is one of the most consistent early indicators of uncontrolled heart failure in seniors. Here's why. When the heart is weakening, it struggles to pump blood efficiently during the day while you're upright. Fluid pools in the legs and lower body. But when you lie down at night, gravity changes. That fluid shifts back into circulation. The kidneys suddenly receive more blood flow than they did all day, and they process it as urine. So your heart, which is struggling, is actually driving you to the bathroom 4 times a night. A study published in the European Heart Journal found that nocturia occurring 3 or more times per night in adults over 60 was associated with a doubled risk of cardiovascular mortality. Doubled. Additionally, and this connects back to sign number 1, frequent nighttime urination is also a hallmark sign of undiagnosed sleep apnea. Every time the airway closes and the body panics for oxygen, pressure in the chest increases, and the body interprets this as a signal to urinate. So if you are getting up 3 or more times a night, please do not accept this as normal. Tell your doctor, specifically, because what you think is a bladder problem could be your heart. Before I show you sign number 5, which is responsible for thousands of sudden deaths in seniors every year and is almost never discussed in routine checkups, I want to pause for just a moment. If what I've shared so far has made you think about yourself or someone in your family, I want you to do one thing right now. Hit the subscribe button and turn on notifications, because over the next several weeks, I'm releasing a complete series on protecting your heart and brain during sleep, including specific foods, specific supplements, and specific tests that most seniors are never told about. This is research-backed information, and you deserve to have it. Now, sign number 5. And please, this one is critical. Sign number 5. Irregular heartbeat or pounding felt at night. Sign number 5. Feeling your heart flutter, pound, skip beats, or race, particularly when you are lying down and trying to sleep. In medicine, we call these palpitations. And while palpitations can sometimes be harmless, in seniors over 60, nighttime palpitations deserve serious, immediate medical attention. Here is why. The most common cause of dangerous nighttime palpitations in seniors is atrial fibrillation, or AFib. AFib is an irregular, often rapid heart rhythm that occurs when the upper chambers of the heart fire chaotically instead of in a coordinated rhythm. And research shows that AFib episodes are significantly more likely to occur during sleep, particularly in the early hours of the morning. The dangers of undetected nocturnal AFib are severe: blood pools in the heart during irregular rhythm, forming clots. Those clots can travel to the brain. A study in the New England Journal of Medicine found that AFib increases stroke risk by 500%, and the strokes caused by AFib are among the most severe and most likely to be fatal or permanently disabling. 500%. And here is what makes this so dangerous for seniors. Many people with AFib feel nothing during the episode. No pounding, no fluttering, nothing at all. They sleep through it. They wake up the next morning feeling fine. Until the morning, they don't wake up. Or the morning they wake up and can't speak, can't move one side of their body. The warning signs you should watch for: an occasional feeling that your heart is skipping or fluttering when you lie down, waking suddenly with a racing heart that fades within minutes, unexplained shortness of breath when lying flat, waking with dizziness or a feeling that something is off. If any of these are happening, ask your doctor about a Holter monitor or a wearable cardiac event monitor. These devices record your heart rhythm continuously, catching the events that happen only at night. Do not dismiss nighttime palpitations as anxiety or indigestion. In seniors over 60, they are a red flag until proven otherwise. Sign number 6. Shortness of breath or needing extra pillows to sleep. Sign number 6. Feeling short of breath when you lie flat, or finding that you now need 2 or 3 pillows to sleep comfortably when you never used to. This one breaks my heart, because I have seen this sign dismissed so many times. Oh, I just sleep better propped up. It's more comfortable. In medicine, the inability to breathe comfortably while lying flat has a specific name: orthopnea, and it is a textbook warning sign of congestive heart failure. Here is what is happening. When the heart is weakening and struggling to pump efficiently, fluid begins to accumulate in the lungs. While you're upright during the day, gravity keeps much of this fluid in the lower body. But the moment you lie flat, that fluid shifts upward, into the lungs. Suddenly, breathing becomes labored. The chest feels heavy. The person instinctively reaches for another pillow, then another. They are literally propping themselves up to breathe. And while they think they're just finding a comfortable position, their heart is sending them an urgent signal. A study in the Journal of Cardiac Failure found that orthopnea is present in over 70% of patients with moderate to severe heart failure, and is one of the most reliable early clinical indicators of cardiac decompensation. Other signs that accompany this: waking suddenly in the night feeling like you are suffocating, which then improves when you sit up. This is called paroxysmal nocturnal dyspnea, and it is a cardiac emergency hiding as a bad night's sleep. Noticing that your ankles or feet are swollen by the end of the day. Feeling exhausted by activities that were easy 6 months ago. If you are adding pillows to breathe, please see your doctor this week. Not next month, this week. Sign number 7. Waking confused, paralyzed, or with a feeling of doom. Sign number 7. waking in the night with sudden, unexplained confusion, a feeling that something is terribly wrong, or waking to find that you cannot move part of your body. This final sign is the one that demands the most urgent response, because what I am describing are the nighttime presentations of two of the most time-critical medical events that exist: a TIA, or transient ischemic attack, commonly called a mini-stroke, and in some cases, an actual stroke. TIAs occur when blood flow to the brain is temporarily interrupted. They can last seconds, they can last minutes, and then they resolve, and the person feels completely normal again. This is exactly what makes them so dangerous, because a TIA is not a harmless event. It is a warning. Research from the American Stroke Association shows that 10 to 15% of people who experience a TIA will have a full stroke within 3 months, with the highest risk in the first 48 hours. The signs of a nocturnal TIA: waking suddenly with confusion that clears within minutes, finding that one arm or one side of the face feels weak or numb, and then it fades, suddenly being unable to find words or speak clearly, and then recovering. A sudden, severe headache unlike any previous headache, sometimes described as the worst headache of my life. Waking with a profound, unexplained sense of fear or doom. I want to be very clear about something. If you experience any of these symptoms, even if they resolve completely within minutes, call emergency services immediately. Do not go back to sleep. Do not wait until morning. Do not call your doctor's office and leave a message. Call emergency services immediately. The treatment window for stroke is measured in hours, not days, not weeks, hours. And in that window, the difference between full recovery and permanent disability can come down to one decision. And before I go, I want to say something directly to you, not as a doctor, but as someone who truly cares about the people watching this. If this video has made you feel anxious, if it has made you feel afraid of closing your eyes tonight, please hear me when I say this. Knowledge is not a reason to fear. Knowledge is a reason to act. We do our part. We take care of this body we have been given. We watch the signs. We see the doctors. We make the calls. And then we rest. Because the Bible reminds us in Job 12 verse 10, "In his hand is the life of every living thing and the breath of all mankind." Every breath you took last night, he knew it. Every beat of your heart while you slept, he was there. You are not alone in this. You were never alone in this. So yes, take these signs seriously. Yes, make that doctor's appointment. Yes, share this video with someone you love. But tonight, when you lay your head down, do it with peace. Do your part. Trust him with the rest. That is not weakness. That is wisdom now. Here is exactly what you need to do. Step 1. Do not dismiss these signs as just aging. Write them down. Acknowledge them. Step 2. Make a list of every symptom from tonight's video that applies to you or someone you love. Bring that list to your doctor. Specifically request evaluations, a sleep study, a 24-hour blood pressure monitor, a Holter heart monitor, and a basic cardiac panel. Step 3. If your doctor dismisses your concerns, advocate for yourself. You have the right to ask for these tests. You have the right to a referral. Do not leave the office until you have answers. Step 4. Tonight, before you go to sleep, check in on an elderly parent, a spouse, a neighbor who lives alone. Make sure someone knows how to reach them. Make sure someone would know if they didn't answer in the morning. Step 5. Share this video right now, before you close it. Because somewhere in your contact list, there is a person over 60 who is experiencing one of these signs tonight and doesn't know what it means. You could be the reason they call their doctor tomorrow. You could be the reason they're still here next year. The most powerful thing medicine has is information in the right hands at the right time. You now have it. Use it. If this video helped you, please share it, like it, and leave a comment below telling me which sign surprised you most. I read every comment, and your response helps me know what to cover next. My next video covers the 7 medications that millions of seniors take every night that are silently damaging your heart while you sleep. Medications your doctor may have prescribed years ago without knowing what the latest research now shows. Click the video on screen right now. I'm Dr. Ryan Vance. Stay informed, stay healthy, and take care of the people you love.